you have to practice 7 main pranayam. You have to practice these 7 pranayams. Its importance lies in the fact that it will control diabetes. Other complications of diabetes will also be checked automatically. Weakness of the nervous system, eye disorders, disorders of kidney, disorders of liver, and also the heart problem. Because diabetics are always at a very high risk. At the time of heart problem, they do feel pain and it really becomes fatal. It is very serious. So bear in mind, practice all 7 types of pranayam. It will not only help improve diabetes, but one may also get rid of the complications of the side effects which occur due to diabetes. Even that will be controlled. First, practice Bhastrika Pranayam. That is a complete package of pranayam. There are 7 main pranayam which have been taught to thousands of millions of people. You also have to practice them. Bhastrika. The first pranayam from the complete package, most essential for the diabetics. Take a deep breath in and breathe out. When you inhale, you have to inhale here, up to your ribs in the lungs. Practice it for 2 minutes every day. Diabetics may practice the pranayam at least for half an hour. In case it is very severe, practice it for 45 minutes and spend 15 minutes on asanas, that's all. Slowly your diabetes will not only be controlled but cured. Practice Bhastrika Pranayam for 2 minutes. Take a deep breath, and if you have many other problems as well along with diabetes, then this Bhastrika Pranayam will prove a balance to your 5 prana, 5 kosha and 5 elements. Nervous disorders may subside. Other problems such as gangrene, weakness, heart problem, they all will subside along with the stress. Practice this Bhastrika Pranayam for 2 minutes. Take deep breath in and then breathe out. Practice with happiness. One of the reasons for diabetes is stress. In case your diabetes is under control, but all of a sudden you get tense, due to this tension your sugar level may increase suddenly. It may shoot up from 150 to 500 suddenly. It increases suddenly. But why? Because of worry, tension. Consuming sweets may enhance the sugar level, but stress is even more dangerous. So always keep happy. Always keep smiling. Happiness and good spirit work as wonders for all kinds of ailments. Therefore, always remain joyful, keep smiling and always remain happy. While defining a healthy human being, our saints gave utmost importance to the happiness. It is key to good health. Pranayam should be practiced with a good spirit. Spend 2 minutes on Bhastrika. Inhale like this. Exhale out. Then, second pranayam, Kapalabhati. It is very important for diabetes. Breathe out your breath. While improving your diabetes, it will also act as a safeguard against the complications. Beta cells of the pancreas will be reactivated. Kidney will become healthy and also the liver. Levels of toxins and harmful substances may reduce. Kapalabhati is the main pranayam. Anulom Vilom is equally beneficial. A diabetic may sometimes suffer from acute problem of skin ulcer. Just exhale your breath. This is Kapalabhati Pranayam. Initially practice for 5 minutes, then gradually increase to 15 minutes. In case of severe diabetes, you may practice for 20 minutes and even for 25 minutes. In few cases, we recommended half an hour duration as well, but that is under special conditions. Normally, you have to practice Kapalabhati for 5 to 15 minutes only. Cholesterol level will reduce, triglyceride will reduce, thyroid problem may also subside. These are the extra benefits. There are so many complications of diabetes, but the practice of pranayam has no side effects. Instead, it gives you additional benefits. You have to exhale out in the Kapalabhati Pranayam. Like this. You will exhale, stomach will contract. This knowledge of our saints, the message of this traditional Indian knowledge is really a blessing in disguise for the patients of diabetes. Practice Kapalabhati, Pranayama and Mandukasana. The practice of these two itself will help you control your diabetes. Kapalabhati Pranayama, just exhale the breath. Stomach will contract in. Those who are overweight, their weight will be controlled. One must note this. Along with this, one will not get constipation. Other problems like gas and indigestion will also reduce drastically. Kapalabhati Pranayama will solve your constipation problem as well as your weight problem. You will be benefited in many ways. So you must start practicing what is being explained here. You will definitely notice major transformation within you, as if it's a new birth. Your eyesight will also improve. 15 minutes practice of Kapalabhati and Anulom Vilom each will help you get rid of eye disorders. Keep this in mind. You must know the fact that in case of 30% people, the reason behind their blindness is diabetes. So diabetes is responsible for causing blindness in 30% of the people. One may never have to face the problems of retina and cornea. With regular practice of pranayama, there will be major improvement. Within 3 months, you yourself will be able to feel it. You can get yourself medically checked. On the first day itself, you will find some improvement right from the beginning. I do tell my diabetic patients, sit right in front of me, practice pranayama and check your diabetes. Some check it in the camp itself, before and after. There itself they find it has come down by 100, 150 and even 200 points in those with very high sugar levels. Benefits are amazing. I have complete faith and belief. I want you also to have complete faith and belief so that you practice Kapalabhati Pranayama. Practice with happiness and joy and a firm determination in mind. A firm determination has very deep impact on the body. Whatever emotions you're feeling, the feelings and sensations, the determination has a very strong impact on your body. Therefore, think in your mind that pancreas is improving. Beta cells of pancreas are being reactivated. The beta cells of pancreas only are responsible for generating insulin, which on coming in contact with glucose, converts it into the glycogen. Glycogen helps to improve diabetes. So practice Kapalabhati with a firm belief in mind and a prayer in the heart that, O Lord, take me in your shelter. Bless me with a good health. May my pancreas, the beta cells of my pancreas become active. O Lord, the power to give birth lies with you, and so also the power to eradicate this disease of mine. Practice with these feelings, with a calm mind and a deep faith in the Almighty. Worries increase diabetes, but the calmness is effective in controlling and reducing it. So practice pranayama with happiness, with a joyful and carefree mind. It will help reduce diabetes right from the beginning. And it really happens. In each of our camps, we get the sugar levels checked on the second day, on the third day itself. And then we show the results which nobody can negate. You may get your diabetes, the sugar level checked according to the parameters of modern medical science. Afterwards, you will find that glucose level has become normal. Kapalabhati gives amazing results. Just as diabetes is called mother of all diseases, similarly, Kapalabhati Pranayama is considered as the destroyer of all diseases, including diabetes. Now, all the ailments of the people of India, including diabetes, will subside with Kapalabhati Pranayama itself. India will become the center of disease-free people, not the center of diabetic people. Keep exhaling your breath. After Kapalabhati, we will now practice Anulom Vilom. With that, the beta cells of pancreas will become active. Along with this, practice Agni Sakriya. You have to breathe out. After breathing out, hold it out only. Then contract the stomach in and then relax it. This is Agni Sakriya for the patients of diabetes. This was Agnisar. This will also help the beta cells of pancreas to become active once again. So practice Agnisar Kriya along with Kapalabhati Pranayama. And then Bahya Pranayama will also help in this process of reactivation. the problem of impotency, weakness, physical weakness will subside automatically. Diabetes has many harmful side effects, but the pranayam has many extra benefits. You may not have to suffer from the complications of diabetes. It is possible only through yoga abhyas. So practice Kapalabhati for 15 minutes and then Agnisar Kriya for 5 to 15 times. Once again, exhale your breath and so you can contract your stomach for 15 to 30 times like this and then can relax it. So this was Agnisar Kriya. To activate the pancreas, there is an acupressure point also in the left hand. Just below the smallest finger, the point lies here below the lifeline. Press it like this. Just below the small finger on the lifeline, this is the point. Press here. And while pressing, if you feel pain, it's an indication that you are pressing the right point. If you are diabetic, then you will feel pain here. Through acupressure, you can even diagnose that whether you are diabetic or not, or whether you are likely to get it. Many people are likely to suffer from it because people hardly adopt proper eating habits these days. Worries and stress have gone up. Comparisons and competitions have resulted in a very irregular and disturbed daily routine. There is hardly any physical work. That's why instances of diabetics are increasing these days. All these things will be controlled through pranayam. You will get relief from it. Practice this acupressure as well. It's very important. Afterwards, press this point of kidney also. This one. In case of any eye disorder, press this point of eye also. Because diabetics may suffer from eye disorders also. If unable to sleep properly, then press this point. This is for sleeplessness. This is for eyes. And this is for kidney. And this one for diabetics. To reactivate the beta cells of the pancreas. To increase its energy, it will enhance the energy of pancreas and reactivate its beta cells. It's in left hand and left foot. So this is the acupressure point for pancreas just below the small finger. And in case someone has heart problem as well, then this is the point for heart. Below the small finger above lifeline. Press then leave. Practice acupressure at one place for 1 to 2 minutes. In case of severe problem, one may press for 5 minutes as well at one point. Press on an empty stomach 2 hours after meals. Practice Kapalabhati Pranayam from 5 to 15 minutes. In case of severe problem, one may increase the duration. After this, practice Agnisar Kriya and then Bahya Pranayam. Just breathe out. After exhaling, keep the breath out and imagine that pancreas is secreting insulin on its own. When you apply pressure on stomach, insulin is secreted automatically and beta cells are reactivated. Exhale your breath out. Practice with full devotion. After inhaling, exhale and keep the breath out only. Practice Bahya Pranayam with Tribandh. Rest your chin in the throat pit. This is Jalandhar Bandh. Contract your stomach to the backbone. Udyan Bandh. Pull your navel part upward. This is Mool Bandh. In case of heart problem and high BP, do not practice this pranayam. In case of cervical pain, avoid Jalandhar Bandh. Practice Agnisar Kriya only. Practice this Bahya Pranayam for 3 to 5 times. It's very important for the patients of diabetes. Many other problems of stomach will also subside with this.